Assistant professor at the University of California, San Francisco, and my involvement in this work is because of some amazing doulas that I have had opportunity to work with for the last 7 years, both at San Francisco General Hospital, the San Francisco County Jails, and at Santa Rita in Dublin and Alameda County, and I'm just so grateful that many of them can be here. As a nurse, and as I like to call myself, an honorary doula. I'm really amazed by the work that doulas have been doing in terms of really trying to support pregnant people throughout their journey, particularly individuals who are carcerally involved. So I'm just so humbled by the panel that we have who are they're gonna spend about 30 minutes telling us about themselves, about their programs and the amazing work that they've been doing. And then I've prepared some questions for them that they've had opportunity to reflect on and to really be able to help you get to know more about their amazing programs, but also to have a real dialogue amongst and between themselves.
Hi everybody, my name is Kenzie Johnson. I'm a formerly incarcerated mom who was 4 months pregnant when I went on the inside. I met Prison Birth Project while I was inside. Met them through some childbirth education and Mothers Amongst Us, which are two programs that we have on the inside. So Prison Birth Project, we work and advocate with incarcerated and formerly incarcerated people. The grassroots of our organization is we worked with currently and formerly incarcerated pregnant people. We provide doula services, childbirth education, organizing around issues affected by their lives and their experiences. We also advocate for breastfeeding on the inside and give them all the breastfeeding support that we can. I know with my experience, the breastfeeding was a challenge, so Prison Birth Project they really helped me be able to keep breastfeeding and really pushed for the medical benefits of it. We specifically train full spectrum doulas, and we do a lot of peer-to-peer childbirth education with all the doulas, so they're able to provide as much support as they can to whomever and whatever they need. That's pretty much, that's that. Do you want to?
Oh, sorry. I guess I should tell y'all who I am. I'm Marissa Pizii. I'm one of the directors of the Prison Birth Project. As Kenzie said, we are a grassroots-led organization, and I guess this would be the opportunity now to say that we actually are in the process of closing down. So that's a really important piece to the conversation we're having today, which is why I'm a surprise guest on the panel, because we are shifting a little bit of our conversation and a little bit of what we are offering today to you all. So I don't want to take up too much of the time. My goal is not to be the talking head because I am not a formerly incarcerated person. And I want to make sure that if there are any questions or any concerns or anything that you would like to talk about along the process of why this process is happening for us, I'm here to answer those questions as well.
My name is Erica Gerrity, and I'm one of the founders of the Prison Doula Project in Minnesota. Our project started in 2003. It's so close to my mouth. Okay.
I know, I kind of felt the same way.
It was you sounded a lot louder, though.
I just have a loud voice.
So our project started a little bit differently. So I was just working inside the prison as a graduate intern, and I was noticing that a lot of the postpartum women in particular were looking really unhealthy, really sad. And I brought this up to this great mentor that I had at the time there, and she said, I think it would be good if you spent some time talking to them about what their needs are, or what would be helpful in terms of programming. So I did that actually for about 2 years then. We had some listening circles and a lot of just one-on-ones, and that was a long time ago when prisons weren't so very overcrowded, so it was very easy for us to move as staff amongst general population, and we could just eat lunch in the cafeteria with incarcerated women, and so it was really easy to have a lot of those conversations. And what came out of 2 years of work was kind of this collectively developed prototype for what would become the Prison Doula Project. And since we're in Minnesota, doulas were not very prevalent in Minnesota. They were starting to kind of make their way there. We're kind of like in the middle of the country, so all great ideas kind of get there last. But so at that point, I recruited doulas from our community and trained the staff, and then we started negotiating access with the facility and writing some policies, and it actually took us about 7 years to get from the beginning point to when we could offer services. And there were some bumps along the way, but lots of negotiation and trust building, and then eventually 2010 is when we started offering pregnancy support in the form of, initially it was one group. The prison gave us permission to, after 7 years of me volunteering there every single week, a couple of days a week, they said, well, we are not sure if we can trust you, so how about you volunteer to teach a group on prenatal education for 1 year, and after 1 year goes by, then we'll revisit the idea of doula care. So we agreed to do that. And about 10 months into that process, there was a woman who had a significant risk factor in pregnancy, and there was some uncertainty if her baby might not be born alive, and the prison said, okay, we're ready for doulas now. So that's how our project started, and we've attended every birth there actually in the last 8 years. I should just quickly say too, we actually work in several jails in Minnesota now too, and there's not a ton of time for me to go into that detail, but we can talk some about the differences of jails and prisons. But we serve about 105 women every week in 7 different facilities in Minnesota right now.
This one's working. Oh yeah, it does work. Hello, everybody. Our doula program is a little bit different. We're not based in jails, but in treatment centers and in the community. But I wanted to start by first reading a quote, and if you don't mind or are willing to take a moment to close your eyes while I read a short little quote from the book called Red Medicine, and the author is an indigenous traditional baby catcher, Patricia Gonzalez. And it says, being pregnant itself and giving birth itself is a ceremony. Birthing is the most sacred ceremony we do as human beings. And if you could, we can all just take a deep breath together. And open up our minds and our hearts and just think about that, what that means. That birth is the most sacred thing we do as human beings. And whenever you're ready, you can open your eyes. The work that we do is really driven by this, by remembering that pregnancy itself is a ceremony, birthing is a ceremony, postpartum period is a ceremony, life is really a ceremony. And so I'll start by introducing or sharing a little bit more about myself. So I am a mother, a midwifery student, almost done with school. I'm a doula. I'm also a methadone dosing nurse, and I also, previously to all this birth work, I was a counselor and social worker, specifically in substance abuse. And I also have a lot of family members who've been in and out of jails, prisons, and recovery themselves. And our program is called Collective Wings Perinatal Project, and we are based out of Santa Cruz, California, just 45 minutes away from here. And I understand it's a very unique city in terms of their policies and the way the jails are run and all the just social services is very unique. So I'm going to read a little bit because I know that sometimes I get a little bit nervous with the microphone, so bear with me. So the main inspirations for our doula project have been in birth advocacy for people of color. Santa Cruz is composed of about 70% white and 30% Latino, mostly Mexican and Salvadorian. We have a huge farm working population, huge undocumented population as well. And also for people in recovery. So advocacy for people of color and people in recovery. And so, yeah, the majority of our clients are in treatment centers for substance abuse, primarily opiate and alcohol. And also, the majority of our clients have a child protective services case or are on probation or parole, undocumented, homeless, do not speak English, and like I said, most of them are on methadone. And we do our best. We are completely volunteer-run, self-educated, and so we offer trauma-informed, culturally appropriate doula services across a full spectrum of pregnancy experiences. And we also go into the rehab and offer groups. And I think that besides the doula services, I think in those groups is where a lot of the work gets done. We do everything from health education to childbirth education, postpartum wellness groups, and even just women's empowerment groups. But our most famous or popular services are the belly casting that we do with the woman, pregnancy photography, we do baby blessings, mama blessings. We also bring in some herbs when we can, whether they're dry for smudging or fresh to smell, or occasionally herbal teas and scrubs, or salves or balms. And we have even encapsulated placentas, even if they're on methadone. So we do a little bit of everything. So yeah, like I was sharing about Santa Cruz, in Santa Cruz we have been, not currently, but there have been midwives who've been able to go into the jails to provide prenatal care. And I think that has been pretty amazing. So in Santa Cruz, when the pregnant person becomes arrested, if it's a nonviolent crime and drug-related, they do have the option of going to a treatment center. Whether it's their first time being arrested or their 20th time, if they're pregnant, they always have, if it's a nonviolent crime, they have the option of going into treatment. And the funding mostly comes from Medi-Cal, but also if they have an open CPS case, it can come from child welfare or probation department. And also in California in 2000, there was the California Substance Abuse and Crime Prevention Act, or Prop 36, which enabled people to do treatment if it was drug-related charge. And also in 2011, the AB 109 bill also, I think the aim was to reduce prison population so people could do their sentences in jails, which meant that then if you were pregnant, or even if you were not pregnant, but if you're pregnant, you're more likely to be allowed to do treatment. And that's really the gist of our program. In relation to breastfeeding, we could probably leave that for later. That's it. Thank you.
Thank you all for sharing an overview of your incredible programs. We're actually a little ahead of schedule, so before I jump right into the questions, I actually really would love to be able to hear about some top of the thought or top of the head comments in terms of what do you see as the facilitators and the barriers to supporting breastfeeding individuals, and what have you done in your programs to really be able to address those issues?
We just had this unique experience playing off of struggling with funding, where I wrote a grant to start a breast pumping milk storage program at the biggest workhouse, which I don't know if other people have workhouses, but it's like post-adjudication correctional facilities at a county level. And we were denied funding from a local co-op that has a funding opportunity, and the feedback they gave us was that they could not understand how breast milk was a food source.
Wow.
That breast milk was a food source?
They couldn't understand how breast milk was a food source. And it's funny, right? We're all giggling. It breaks my heart because I cannot believe what year this is, and that somebody feels like that's legitimate feedback.
Wow.
It kind of sounds like when we tried to implement breastfeeding in the prison where we are, that they didn't want to allow it because they considered bodily fluids being contraband.
Yeah, and that's another thing that I think a lot of places are very far ahead of Minnesota on this. Like right now, we're doing work in Alabama, and Alabama's going to have a breastfeeding, pumping, storing milk policy that's light years ahead of our state. And some of the reasons are, I don't know if you guys have heard this, but that breast pumps themselves pose a safety and security concern, particularly the tubing for breast pumps, that people could be strangled with them. This is really our work. We really have to deal with this stuff. So then you have to come up. My recommendation was that we should collectively write a white paper on how breast pumps do not pose a safety and security risk to correctional facilities, and that breast milk is not a pathogen. I mean, the learning is very far behind in corrections on this topic. I would say that's the biggest barrier, honestly.
I agree.
Yeah, I would say that too. I would also, I think what was really interesting in our perspective of this work is, as Kenzie said, for the longest time it was contraband, it was bodily fluids, it was all of these different really ridiculously based in medical evidence reasons. And now what's really interesting, just to talk about some of the more facilitator pieces of it. So we started out and we pushed, they finally said yes. And then it was on us to get all of the materials. So we had to get the medical grade breast pump donated to the jail. We had to get all of the milk bags. Anything that was related to this breast milk and the pumping of the breast milk had to be done by us. About a year or so ago, the jail realized that there was benefit for them to be presented as a jail that is breastfeeding positive, and has now taken over this program. And it's now become this thing that they are the ideal facility within the state and are the ones that are giving resources and references on how to do this program within the region. So it's really interesting. We also find that they've gone to, we don't need anything. We have all of this under control now. They've got a little label maker. They were very proud. We have a label maker, and we put everybody's labels, and they have all their materials can be blah, 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 and they have this whole system. So while we find that a benefit and a kind of positive thing that they've embraced it, we also understand that it's just for their own benefit. Like, that's the frame in which everything has to be viewed under, is how is it benefiting this facility, because that's why they do it.
For us, most of the women we serve are on methadone or have very recent substance use histories. I would say that the biggest barriers are provider bias and just the stigma around harming the baby. What could methadone do to the baby? And also, once they have their babies, then it's the NICU nurses and the pediatricians who really are the ones counseling them on breastfeeding. And they, every pediatrician is very different in what they say. In terms of other barriers, are just being in treatment, you have so many things to do besides caring for your baby. So I would say like lack of staff support and lack of lactation support. I believe that they need their own, that there's no one who's a specialist on breastfeeding for people with substance abuse histories. And in terms of how we advocate and how we can support is by reminding our clients that they do have the right to breastfeeding and just providing a basic education around breastfeeding and advocating with staff and sometimes we will go to the NICU. Most of the time, if they have been on methadone, the babies will stay in the NICU for a couple weeks while they address a neonatal substance, what is it? Neonatal withdrawal abstinence syndrome. So yeah, this is an area where we really need a lot more support, and we dream of one day having a postpartum doula programs that can focus just on breastfeeding and bonding and postpartum mental health.
It was brought to my attention that the National Commission on Correctional Health Care on November 5th, which was about a month ago, released a position statement on breastfeeding in correctional settings. It is on the resource table, but there are two interesting points that I would like to draw everyone's attention to specific to this policy, which I find to be very, very exciting, which is there are very few contraindications to breastfeeding. Breastfeeding is safe for women with hepatitis C and is encouraged for women who are taking methadone or buprenorphine, as there are benefits to their infants. And then it goes on to talk about proper nutrition is essential for breastfeeding mothers. They should receive a well-balanced diet with additional calories, calcium, vitamin D supplementation, prenatal vitamins, and no more than 3 cups a day of caffeinated beverages, and increased fluid intake. So for those of us who are interested, the new position statement on breastfeeding in correctional settings is on the resource desk out front. So this should be applauded. I'm going to transition now and ask the panelists to reflect on some questions that they've seen. We'd love to get you involved as well. We're going to have more of a conversation, a discussion, not necessarily so much of a Q&A. And so as you're listening to their responses, as you're listening to their questions, we really would encourage not only each of us to dialogue with each other, but also with you. So with that, Erica, I'm going to put you on the spot, only because we're going alphabetical here. How does the culture of the facility shift with the presence of a doula program? What have you noticed in all the different institutions that you've been in? You're in multiple states. How does having a doula program change the facility itself? And then how does it impact or affect your program? Could you talk to us a little bit about that?
Yeah, I could talk about this a lot, actually. I will restrain myself. But, so in Minnesota, what's different is when we wrote our anti-shackling bill, we put doulas in the bill. So everyone in the state of Minnesota has access to a doula if you're pregnant and incarcerated. So that got rid of any of the dialogue that was happening about if the doula could come in or how often she could see her client, because it's just like we have to be given permission to see the women that we're working with, the pregnant people. And so because I was there from the very beginning, I would say the biggest shift for the population of women in the prison is just significant increases in the day-to-day mental health that they're experiencing, and not feeling so isolated and alone and ashamed of the experience that they're going through, which was their predominant experience before the doulas. And they were getting that from everywhere, right? We heard some people talking this morning about how the nurses are, at every intersection, it's just layered with shame about why you shouldn't be in prison, or what, don't do the crime if you can't do the time, and like, just suck it up. I know this is terrible, but it's as a result of some terrible thing that you did. When we all know that there's women in our groups who have violated their probation for not wearing their seat buckle. I'm sorry, that's not a terrible crime. But there's just a lot of bias among healthcare providers and at the hospitals. And so I see, like, as doulas are being present, and our doulas are present a lot in the prison, that people are asking more questions about birth. So from the administrators or the wardens, all the way down to like the people that are in the control center, a language around birthing has come up inside the prison. So like the watch commanders know what dilation is, or like how effaced someone's cervix is. Like that was not happening before doulas were in the prison. And there really was this, I think it actually wasn't coming from a place of bad intent. I think it was coming from, I think it was coming from, I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from a place of bad intent. I think it was coming from that it felt horrendous to watch another human being go through that, and because it was too difficult to actually have to engage your own emotions about participating in this process, people would split it off and justify why they were strip searching pregnant women or why they were shackling pregnant women. And I think doulas have given officers and prison administrators the freedom to be respectful of birth and to be participate positively in that. So one good story I can quickly think of, and then I'll pass it on, but it was a birth that I actually went to, and it was a mom that had some significant trauma, and her baby was born, and she was really kind of trepidatious about bonding with her baby, and I was just kind of gently coaching her through that a little bit, or just giving her, not that she needs permission, but just saying, your baby loves you, your baby is perfect, look how beautiful he is. And she was just so getting lost in the experience of loving her baby and talking about how beautiful her baby was. And then pretty soon we're all having this kind of hormonal, we just went through birth together, rush. Then the officer is getting pulled into it, right? The officer is yeah, that baby is beautiful. That baby is so beautiful. All right, so then we take pictures at the births. And I brought the photos to the prison to drop off in the control center. And there's a woman that works in the control center, officer, and she gives us a hard time. She notoriously gives us a hard time about everything. And she just has a very stoic, not that anyone's ever met someone that works in a prison that gives them a hard time, but, she's just stoic all the time. And I said, here's so-and-so's pictures of her baby. And she broke from her normal self. And she said to me, the word going around here is that she had a pretty baby. So that was maybe 2 years into the project, and that told me oh, something is changing here, because that officer at that birth had come back to the prison and had been talking about it in a positive way. And this officer, who was kind of previously untouched by this experience, was starting to really maybe think about that in a different way.
Kenzie, you guys have alluded to the closure of your program. And, I think that's, first of all, it's a sad thing for me to hear. And it's always really hard when I think about doula support, especially in the carceral system. So I guess I would ask you a couple of different questions with that frame. Can you talk about sort of some of the pieces that have contributed to that, and then talk a little bit more about some of the obstacles that you faced or the process that you used in setting up your program, and then give us sort of a snapshot into, your original question was going to be about sustaining your program, but I'd love to hear your reflections about how the decision was made to really stop services. If you could just share a little bit of that with us.
So we're going to jointly answer these questions,
Cool.
if that's okay.
Yeah, that's fine.
Just more on the logistics of things. Marissa's better informed, or able to inform you on that. Some of the obstacles, are you talking about as far as being successful doula and breastfeeding doula? Okay, all right. Let's see. I think a lot of the hardest things are dealing with the politics of the prisons. And then the rules are counterproductive to the needs of the breastfeeding parents and stuff. For instance, breastfeeding is it was recently implemented to the prison we work with, is you're only allowed to breastfeed for 6 months. And there was really no prior limit to that. And I think my experience with the breastfeeding, I don't know, maybe they always challenged me on being able to breastfeed and going up. And at 7 months, they asked me to stop breastfeeding. And at that time, my son was in Boston Children's Hospital diagnosed with leukemia. And to me as a parent, that was the only way that I could be of any support and love and care for my child. And they tried to use PNs and lipids, and they tried to give him formula, and he was allergic to every formula they gave him. So it was detrimental to his health, and I had to get letters from the doctors at Boston Children's to send to the prison to state that it was medically necessary for me to continue breastfeeding for the duration of my sentence, which was, they didn't like that, and it was really hard because I wasn't always allowed to go pump when I needed to. Tried to stay on a schedule, but they always seemed to tell me that I was an inconvenience or oh yes, I was attention seeking, trying to get out of the pod. Different things like that. They just didn't understand, I think, the medical and the emotional benefits of it, which anybody who's a breastfeeding mom, in or outside the prisons, I mean, knows the emotional attachment of it. I mean, what else can you do for your child when you're incarcerated and visitations are limited? You can't breastfeed your child at a visit unless it's a special visit. So being able to pump and send milk to your baby, I mean, that's the only thing you really can do to provide for them and show them how much love you want to be able to give them, that you can't be there physically. I mean, I guess would be some ways, but and I think on some of the other obstacles, I'll let Marissa speak into that one on the closing and stuff.
So it was, first of all, one of the most painful decisions that the group of us ever had to make the choice to close down and be done. There were so many different layers and pieces that were involved in that process. Some of it was the actual just dealing with the facility. So when we passed the anti-shackling law in 2014, that completely changed our relationship with the jail. We went from being a program that was kind of annoying and did some things over there to straight out attack. They started finding reasons to eliminate our access to the jail. So if a doula showed up with the wrong shoes, we'd lose access for like a month. Yeah. Shoes. The doula would say slightly the wrong thing in class, we would lose access for another 2 to 3 months. We would advocate in the hospital for our client, we would lose access. Every time anything happened that they could use to take away our access, they did. So it started to become this game of just trying to play and like whatever we could do to continue to keep the access open, which then of course started to hit at our integrity and our value system, right? Because now you're starting to play this game where you're kind of pushing up on the very, very, very edge of a line of, I don't want to be that person. I am not somebody who works behind the wall for that institution. I'm somebody who works behind the wall for the people. And so that was one of the many balls in the air. The other ball was sustainability. The reality that as we've been doing this work for 10 years, we've come to the realization that we have to care for and really protect our workers as much as we have to care for and protect our clients. And so the staffing and the amount of people power that we needed to support fully this program was just unattainable at the budget that we were at, that we were somehow supposed to add so much more to be able to be the successful program that we want to be with the integrity that we wanted to have. So we had started things like instituting a social worker on staff that was just for the doulas, to check in with the doulas and make sure that they were getting the support services that they needed. Well, that's another employee that you have to pay. It's another step. We realized that we needed a lot more human power. And the reality is volunteers are amazing and wonderful, and volunteers have lives. Volunteers have a lot of things, and it's just a different game when you pay people. We also had funders looking at us, telling us that there's no way we were going to be sustainable given the fact that we were a volunteer-based program, and expected us to start paying our doulas and paying our staff at a much more equitable rate. For many years, our staff was working 4 hours, 18 hours a week. We were never full-time, but for the last couple of years of this work. And so you can see like the ways all of it is coming together, and the reality is we just burnt out. We got to the point where we just couldn't do it anymore. We couldn't do it anymore and be assured that we weren't creating harm. And the reality of this work is that you do no harm. You don't want to be the one that is actually facilitating the harm. And that's for everybody involved, not just for our clients. Our doulas, who we are trying to bring from formerly incarcerated ranks. We have to have the support services and the things in place to be able to make sure that they were getting what they needed. And the reality is, we can say that they weren't. While we think we did amazing work, and we did an amazing job, we passed a lot of things, we stood in support of a lot of people, we did a lot of really important work. It was starting to come at the detriment of the people doing the work. I actually had to go on an emergency medical leave at the end of August because it all just kind of came crashing down. So it's like when all of these things are surfacing and rolling together and coming together, the reality was that this group of people needs to stop. We need to find a way to lay this down and figure out how to pick up the pieces that need to be picked up in order to move forward again. And so there are people within this group that want to see us move forward again, that do want to continue this work. And the reality is, the group of people that have been doing this work for the last 10 years, some of us for the full 10 years, some of us only for a couple of years, just don't have it anymore. The way I like to tell people is, I have had to bear witness to more trauma than any one person should ever have to bear witness to. And I don't say that as in any way equating the experience of people who've had to live through the experience of incarceration. In no shape or form is my experience anywhere near that. And I will honestly say that I have a lot of internalized things from watching so many people have to live through that. There's only so many times you can watch somebody be so dehumanized that they literally are just a number and maybe a last name before you start to see the world in a really, really awful way. And so for me, the reality was that I made the choice with a group of people that we need to stop and we need to regroup and we need to come together and find a way to do this work so that there's health and wellness for everyone. And that, yeah, I'll stop there.
Thank you for that, Marissa. I have to say, I was privy to a conversation, you used the word trauma, and I think it's important that we bring that into the room, because when we were preparing earlier this morning, Erica and Maria and I were talking about trauma, and I'm hoping that one of them would be willing to expand on that conversation in terms of, it came up around non-consensual touching of birthing people. And sort of really, wanting to have that discussion. But I think we need to perhaps have some comments around the role of trauma and how within your programs you really orient yourself to be able to not only identify trauma when you see it, but then also be able to respond, but also not be overwhelmed by it.
I can say something. I also wanted to introduce the rest of my team here. I have Nadia, Sylvia, and Gretchen. And, okay. And this is something that, since we began, we've been offering services for 2 years, and having had the background in substance abuse recovery and birth work, I really understood the importance of building into our group the ability for us to have time during our meetings for self-care, self-reflection, support, and processing, because it was very important to me that the doulas that joined our collective had experience with dealing with these very strong situations. I think it's very important for doula programs to not only be able to support clients, but also their own members, because it happens every time during groups, during interactions with community members, and during births, and certainly in the postpartum period. So we try to do workshops for the doulas, and that's why we incorporated a lot of ceremonies into our groups. And also bring in our cultural practices and just it's the spiritual connection. Recovery, most people use the 12 steps in the treatment center, but some people have their own ways of spiritual recovery. And so those are some of the tools that we use to address when trauma comes up, because it really does come up every day. And I think taking retreats or just days to just like check in with oneself and each other, and even have meetings with the staff. I know we're so lucky that we don't have to deal with being in a correction facility. We have very burned out and very our program has very little resources and very understaffed, and yeah, they're burned out, but they do have enough, they care enough to be willing to listen to anything that we feel like it needs to be addressed. That's the gist of it for us.
Do you want me to talk about the trauma too? Yeah, so this is just hard to talk about, period. I would definitely say that as not someone that's the chosen leader, but kind of just has happened because of my skill set, because I'm trained as a psychotherapist. So that's the role, that's a blessing and a privilege, amazing to have that education so I can bring that to our team. I was telling the example this morning, like if something is happening at a birth and it's overwhelming, like we know this is what creates PTSD, is when you're overwhelmed by a situation and you don't feel like you have an option and you feel like, you're just gonna die or you can't get out of it. That's what creates kind of damage or lasting trauma in your brain. But technology is pretty amazing, and then our staff can walk right out of the prison and call me, or they can even just walk right out of a birth for 5 minutes and text me. And because, to be honest, I don't have great healthy boundaries about work, I pretty much always have my phone on me. So then if it's 2 o'clock in the morning or whatever, I mean, this is really happening, then I can talk to them in real time. So is that very sustainable? No, it's not very sustainable. And like, I definitely think I'm like a significantly changed person, probably because of our work. I think I probably will die sooner than most people because of it. But at the same time, it becomes like you're just in it, and I could reach a point where Marissa is too at some point in my life, I guess. I moved to the country last year, and I moved out of the city to reduce my cost of living so that I don't have to feel the pressure of trying to make money and live in the city, but also for my own mental health. I work from home a lot. So I might be talking to somebody that's having something egregious happen to them, but I might be walking in the woods while I'm talking to them now, and that kind of helps a little bit. I have a porch that I sit on, and I stare at the wall a lot sometimes, because like trauma is your brain getting stuck, right? It's just like on loop, like this doesn't make sense to me, or this hurts so bad. So my brain is trying to use the rational parts to like integrate this or make sense of it, but there's no place to put this. So then that's where this repetition compulsion, right? That's the word, comes again and again, and you have flashbacks and you can't stop thinking about it. So you have to find, like Maria was saying, really like body-based ways to get it out of your body and do that collectively and as a group. So we have a retreat every year that we go on for 2.5 days where we just spend time together. But I would say our project, we have about 20 staff that work in our project now, is like sometimes functional, sometimes dysfunctional family, but not dysfunctional and like we ever hurt each other. Like no fighting, like just nothing but really genuine love for one another and just this deep bond that we share in this work. And that makes it really possible, I think, for us to continue on. But it is so much trauma. There's not one, like someone this morning was saying, I'm telling this story and it's a horrendous story, but it's not unique, and that's true. Like every woman we're working with is gonna talk to us about definitely sexual violence. We hear just horrible things that happen to their children, and our group is the one safe space where they have to come and process it. And it's stuff like, I don't ever watch scary movies or anything on TV, because what I hear in the prison is 100 times worse than anything someone in Hollywood can imagine. I mean, it's just absolutely nightmarish. So we're just kind of doing the best that we can and genuinely loving and supporting each other and taking the best care of ourselves. But that's not even a great option. I mean, I hope that we can sustain that for a long time to come. And bringing new people into the project as we've grown has been so amazing for us, because people are coming from different disciplines and totally different backgrounds and different families and different geographies and different religions, and we all are coping differently, and then we're all sharing that with one another. So that has been a form of resiliency, I would say, and just love from the greater like birth community of people who say things like, see me in the grocery store and say like, I just never told you this, but I'm just so proud that we have this in our state. I mean, that goes like a really long way for me, at least.
That's great. Before I ask you a question, I'll give you a chance to reflect on it, because I really want you to think about how the recognition of the opioid crisis has really impacted all of your programs, and sort of how you all are thinking about that. Are there any questions or comments or statements from the audience, or anything you'd like to ask the panelists? We do have a roving microphone. Are you on?
Okay, so my name's Cynthia Chandler. I'm an attorney. I've been working with people in women's prisons for, 25 years. First of all, I just want to honor the work that all of you are doing. It's really amazingly awe-inspiring to listen to you, so just thank you. I'm kind of heavy from it. So, related to the issue of trauma that all of us doing advocacy with people inside see and experience, and related also to this question of how do we know when our work doesn't do harm or it doesn't get twisted into something we never wanted it to be. One question I keep wondering about with the breastfeeding issue is if there's a tension or a policy around how to safeguard the milk, given that it is in fact a food source, and that most food sources we take enormous precautions in this country to make sure that they're not harmed, or nothing's added to them, or nothing's tampered in any way. And I know as someone who had to breastfeed in between legal visits and store my milk with administrative offices, that I would throw away the milk that I pumped on the grounds because it was never in my line of view. And I had received death threats from guards. I received incredible retaliation. I had clients who literally were killed by people who were staff at the prison, and I won a wrongful death lawsuit in one of those instances, but my client was still dead, right? So there's no way in the world I would give my kids that milk. And so one of the things that I worry about is what we could do for best practices to make sure that children aren't harmed from the milk that they get, and what kind of attention is being put into that.
Sure. That's a really good question, and I don't know that that's been something that we've ever worried about before, to be honest with you, whether or not the milk is being stored in the appropriate ways, beyond having to trust, as we do in all of the ways of walking in and out of a facility. Unfortunately, you have to go with what they tell you, because you could ask 500 questions and they're going to tell you all the answers they want you to say, or tell you that they got it under control, and that's all you have to operate with. I don't have anybody, we don't know anybody or had anybody that has had any issues or concerns with their breast milk and storage and use of. Honestly, the bigger issue is the family, and whether or not they actually pick it up and use it. Or DCF. Are they going to actually pick it up and give it to the foster parent? Right, and then also, like, that's where the labels, at least in the facility we work in, came into and what have you, and they were really, really adamant about ensuring that that's not an issue. It's also a little bit harder for me to conceptualize this question, because we are in a more liberal-based environment in Massachusetts. So I don't really see the COs making those kinds of choices, because they know the effect is on the child. I've seen other versions of that show up, for sure. There's many ways that they do that, like when they go back and talk about people's births and tells their entire personal history and the lack of care about somebody else's stuff. But I have not really seen that or felt that that was a concern or an issue. I don't know if you all have that concern or issue.
I think this brings up such a good point that incarceration, even where you come from, it can be a particularly conservative environment or a liberal environment, but that every facility has its own culture, and those cultures can be really healthy, or those cultures can be very, very unhealthy, and I think it might be actually location by location, but I definitely hear what you're saying. I mean, there's some facilities that I work in that I feel definitely much less safe in than other facilities, but we have the most trouble with medical care. It's actually, I'm sorry if anyone is here from correctional health care, because I know there's lots of great people that work in correctional health care, but that's where our big challenges lie, with not being able to get people access to health care when they urgently need it. And we haven't had as much experience with pumping milk, but being fearful for your body or your breast milk is definitely a legitimate concern, I would say.
I know with my experience with the breastfeeding, pumping part of things and whatnot is they were very strict on the mom that was breastfeeding. It was up to them to take care of their pumps and clean their pieces, and we had to put the labels on. We each had our own spot in this big freezer that we had to keep our milk in, and it was basically up to us to obtain everything that had to do with our milk, including getting in touch with our families to pick it up. And if they didn't pick it up by a certain time, a lot of times they would say, it's been in here too long or whatever, and ask us if they could discard it or tell the family they had to pick it up that day, type deal.
Can I say one?
Yeah,
Sorry
yeah.
to interrupt.
No, go.
The one thing that I've heard is actually the opposite about breast milk storage is when we bring it up with facilities, it's like this idea that women are somehow going to put drugs in their breast milk.
Yeah.
And they're going to send that out. And
Yeah.
what if the baby gets drug-tainted breast milk? And I'm
Yeah.
just this just does not really actually seem possible. But okay, are women using on the inside in the facilities that we work at, there really isn't there's some issues with sharing prescribed medications, but the reason people are sharing prescribed medications is because they're not getting the psychotropic medications they actually need, so they're self-medicating with whatever they have access to. But yeah, that's what I would say. The jails and prisons are telling us that's a reason we can't have a breast pumping program, because they can't make sure the milk is safe for the babies because the mothers might be ingesting something. Yeah.
I know where I was, the other thing is that they do random cell toss and random urine tests and things, and it's under protocol that they can actually randomly test your milk as well. So your number could get pulled up and they could decide, okay, we're not going to toss her cell, but we're going to go check her breast milk. That type of stuff. So there's always, that's another thing that you have no control over. But if they touch the breast milk, honestly, they got to throw it away because they've tampered with it. So.
Yeah.
There's a question in the back, and then there's a question in the front.
Thank you. My name is Sylvia, and I am speaking from Santa Cruz, part of the Collective Wings Perinatal Project. Kenzie, this is a question for your group. First and foremost, thank you so much for all the work you've done for these breast pumping mamas in your correctional facilities. Sounds like you didn't get the recognition that you deserve, so congratulations on starting that. This question is in terms of kind of population and data in the correctional facility that you are at. How many women and how many breast pumps were you seeing kind of were donated and needed in that? And was that given and resource in numbers just what you needed for that? Or do you see that you need more tubing, you need more bags? Is this something that is going to continue after you guys are out of there? And what does that look like?
Yeah. We hope so. There are a few nurses and one midwife that we know of that hardcore advocate for breastfeeding and want to see it happen, want to see it, you know, to this day, she tells me I'm the longest they've had ever breastfeed there under circumstances, but still, it's the longest they've ever had someone. As far as breast pumps, gosh, we have so many available to so many available to so many mamas that need them, and they're always available. The jail did have what was it, that big blue one?
Yeah, so the medical one that we had donated was the only one that was available originally, and now, I don't know if this is in other states, but in the state of Mass, if you haven't had a breast pump within the last, it's like 2 or 3 years, your insurance company automatically has to give you one, and you can walk out of the hospital with a breast pump. So we actually have breast pumps coming out of our ears right now because we have a former leadership circle member who used to work in the medical field and got a bunch of breast pumps donated to us. And so now people don't need them anymore. So we're overwhelmed with breast pumps right now. We could actually probably give one to every single person in this room. But yeah, we don't need them because the state does that now. And so that was part of what our doulas did with our clients, which of course became another source of we're advocating too much. We were told actually we're not allowed to advocate. All we can do is encourage her to advocate for herself. So we used to do things like calling up and getting the breast pump and making sure it left with her so she'd go back to the jail with it, blah, 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 blah. That was no longer allowed. And so she had to pick up the phone and make the phone call, even though she's not allowed to use the phone. So tell me how that works. And so that kind of whole process.
And not only that, but once the breast pumps arrive, you don't even get them right away because security has to inspect the whole entire thing. And they literally tear apart the breast pump. Like, I got my first breast pump, and I had to call my husband to ask him to order me a new one because they took it apart and had no clue what they were doing, and my breast pump didn't work. So, yeah. So there was, I made a real big stink about that one.
Question in the front. Tell us who you are, please.
Hi, I'm Julia Arroyo from the Young Women's Freedom Center in San Francisco. I do some of the detention work there too, and I have 2 questions. The first question is, so you guys, just so I'm clear, you guys are coming in as like an outside program, the doula program, so you're not coming through like the medical, like that's not how you guys get in through any type of medical. Okay, and my second part of my question is, if you guys at all get reached out by youth, by 17 and under, and like what is the process? Have you been inside any youth prisons or children's facilities? Okay, yeah, so it's I've recently seen in San Francisco some of the doulas coming in on the inside, and so I just noticed that the shift with that, but hoping that it would be able to be expanded all the way around because our youth are still pregnant and parenting as well.
That's a good point because, I was actually thinking about that in like the juvenile detentions and things like that and stuff that, there's teen moms, and they probably need that support. And most of the support that a lot of us do is based on, adult prisons, I guess you could say. So, yeah. That's a good thing to check into. We
had a couple of times where people would reach out to us with youth cases, but very rarely, surprisingly. Yeah, they definitely need support.
Can I say something about working with teen moms? It just came to our city, the Nurse Family Partnership Program. We have been able to serve women that are younger through public health nurse referrals.
Mm-hmm. Mm-hmm. We do too. We take referrals from juvenile facilities.
That's awesome. You've never been at the capacity to be able to do that.
Good.
Hi, my name is Darcy Stanley. I'm a member of the Birth Justice Project, another doula organization here in the Bay Area. And this is my colleague, Adi Afek. And my heart is pounding with just like the resonance of hearing your story and like what our group has gone through. And I'm feeling really affected by being here and grateful for your panel. And one quick comment of just like one of our struggles has been that issue of appropriation by the prison industrial complex of our work, and having our work become theirs and owned by them in ways, and trying to find a way to be in the system but not of the system, and the complication of that. But actually the question I'm wanting to hopefully hear from you all about is around volunteerism, and I guess I don't want to ask too specific of a question because I want to hear what you have to say, but one of our struggles has been, as a completely volunteer group, then we have autonomy to work the way we want to work. And then when we got some funding through the county to expand into another jail, then we suddenly had MOUs, and there was funding, and they got to have opinions about how we did our work. And so then we decided to come back to being to not seek more funding, and the sustainability issue is so difficult. So we're in a very similar position to where you all are, and it is really painful. And so that's one part, and I'm sorry, I'll wrap up, but just also the issue of like volunteerism as a concept, and who gets to be a volunteer, who gets to work for free, who has the privilege to do that, and I'll stop there, thanks.
Big comments?
Oh, okay, my research partner is telling me I have to answer that question, but Maria's going to go first. No, her and I were talking about it right before this morning, right?
Thank you, Darcy. I actually would love to see if any of our Collective Wings members want to share your experience being a volunteer, and how much it takes to do this sacred work without pay. Do any of you want to say anything?
Yeah, give her the mic. Give her the mic.
Well, thank you for the question. I think that there's just so much I could say on that, but it's a really important question. Let me collect my thoughts for a moment. Well, my name is Nada, and I live in Santa Cruz. I'm part of the Collective Wings Perinatal Project. I've been a member for almost about a year. I've been doing organizing work, though, in the Santa Cruz community for about 10 years, mostly around what my group was calling like Indigenous solidarity work, so thinking through, and I think it really was related to some of the deeper trends that I'm hearing at this conference of just if we're willing to take on this really deep and grief-inducing narrative that the history of this country is built on chattel slavery, which is why I think it's really important that you're using chattel in the term, and the stealing and colonization of indigenous lands, then the work that we're doing now, supporting people in their pregnancies, has really large implications in how we're processing really big collective grief and trauma. And then when you throw in also a complicated narrative of capitalism and how it extracts our labor, and these are really big conversations, right? Then you start to get into what it means to pick apart this word volunteer. It comes from volition. I've thought about this a lot. And if you are doing something of your own volition in this day and age, it does start to begin to ask questions about what privileges you have to have volition. And when you're talking about prison in particular, you're stripping someone of their volition in this really, really fundamental way. And I think that demanding that people hold a really complex, thanks, I just dropped everything. Demanding that people, I guess that sounds a bit fierce, but yeah, like fiercely kind of taking on these questions of courageously looking at privilege and power and internalized oppressions within oneself and why one's coming at the work, I think makes for more transparent and honest organizing. However, acknowledging that we're human and that things are going to come up that we're going to have to take more time to talk through. But the nature of like this being all on our own like terms makes the processing that much more sometimes like anti this narrative of progress, that somehow progress has to look like this like linear path and program. But I mean, I think that in response to just like your guys' program transforming, like taking this break or like really dismembering, that there's power in that. And to remember, I guess, like these sort of like anti-colonial, non-linear memories of time in doing this work is really, really important, because then it creates a sustainability, because then you can see that you're connected to this work through your ancestors, through the future generations, and creates a kind of spiritual practice that will hold you when those moments come up where you have to really like face like, well, who am I? Why do I do this? What pain am I holding? What kinds of like narratives of freedom do I want? And what does that mean in the context of like other people who don't have like the privilege or the time to think about those things or even ask those questions? Santa Cruz is an incredibly segregated and racist place, like most of the United States, but then hides under this veneer of progress and progression. And so, in particular, we're really lucky that we get to work inside of these facilities that, aren't correctional facilities per se, but also, I think that there's a lot of processing, though, that has to happen because things come up at our weekly group meetings and inside of ourselves that are always like kind of nagging at like the what's underneath, if that makes sense. So I don't know if that answers what you're saying, but I feel like it's sort of my own narrative in thinking about volunteerism and what it means to volunteer is like, I guess like the questions that I want to bring in and be more curious about inside of all of us is like, how are we incorporating these bigger narratives of anti-racism, decolonization, abolitionism, inside of also like addressing that we have to deal with what's in front of us right now.
Yep. Thank you for those comments.
Thank you, Nadia. That was beautiful. And totally agreeing, adding to rising from the rubble, getting that passion and turning it into progress, taking the steps necessary. That is volunteerism, not out of monetary compensation, it's what feels right in your core, and not even debating with yourself, not even saying, should I do this? No, it is in here. I'm doing this, and I'm going for it, and I'm moving. Thank you, Nadia, for adding all that. Do you want to add me?
So we have multiple questions. I see 3 different hands, and I know that there's one last question that we have time for. There's a breakout session on this exact topic. So if you have not had a chance to ask your question, there will be a breakout session, but we'll have one more question. I think her name is Ruth.
Can I say one thing about the volunteerism? Because actually we don't have a volunteer program, and I think we're really different than that, and we don't believe in volunteerism for our program, and I really believe that if a woman is going to leave her children and find childcare for them and travel 45 minutes in crappy Minnesota winter to go attend a birth at 2 in the morning, I think she should be getting paid for that. And so I knew in the beginning, though, I didn't know if that was going to be sustainable, to be honest. I just said, like, we're going to go for this.
Right.
So we actually pay our doulas $1,100 a birth to attend. We pay the highest rate.
And that's not market rate in some places.
It's not, but in Minnesota.
But it's better than nothing.
Well, in Minnesota, it's as high as the highest paid doula gets paid because, and it's starting to go up a little bit, but when we think about people that have complex needs, this is not like I went to doula training last weekend and now I get to go do my practice hours. Like, we need people that really need some skills that can match the level of trauma and commitment and emotional exhaustion. I mean, there's like combat pay in there. So,
And Minnesota it's one of 3 states that actually has public insurance coverage for doulas as well. So let's remember that.
yeah, it is. But we can't access it because if you're in prison, you're kicked off of Medicaid.
Absolutely.
Yeah.
Yep.
Yeah.
Hi, my name is Tanya. I am a formerly incarcerated mother and a survivor of incarceration. and luckily enough to be here and honored to be here with the Minnesota Prison Doula Project. Along the lines of the sustainability, this is my heart, right? Because I live this, and I see my children living this, and what has happened to them. And we're all in this room together, and there's so many people here. How are we going to start to make this sustainable to be able to service these women and these babies and make this priority in our corrections system? And how can we bring that? Do you guys, I mean, I know that people have ideas on how not to lose to make it happen without losing your integrity, right? And to not have to become the system. Do you guys have more ideas on how to acquire funding, how to make this sustainable for the workers, for the doulas, for the people in the programs?
Because there's like another level to the Medicaid funding or being a volunteer or just paying your staff, and that is, so if you are going to be a nonprofit and you're going to pay your staff, then you have to raise the money through these traditional nonprofit 501c3 foundation kind of giving, and that is so complicated and convoluted, and you're just signing up for another system that has kind of a nasty history. So we have been having, this is going to sound so insane, but we've been having a lot of debate in our project about actually not being a nonprofit and being for-profit, because I know that sounds crazy, right? But because what happens is it's the same money coming from the same place, right? So if we go to these big, huge foundations, I'm going to like say Cargill Foundation or something, who are probably amazing people, but I no longer get to have autonomy. So that is all very complicated in terms of sustainability. So I just want to kind of throw it out there. But.
Well, and I'll put the radical thought in the room that maybe we should just stop locking pregnant people up.
Yeah.
That's crazy making.
And I think, you know, having pilot projects that will allow us to understand more restorative justice approaches might actually get us to where we can more ethically resolve this issue.
I think it's going to happen in our lifetime.
And if you
I
think
think it's
about it,
already
it's only 9 months that they have to just, wave their hand in order not to be able to provide the things that they know they have to provide. Now, they get a certain allocation for incarcerating a person, period, for like the year. Okay, and so out of that money that's allocated toward just keeping us locked up, tissue and things of that sort, why don't you just like you said, leave us alone for 9 months, and then, after the 9 months term or 10 months, I should say 10, 12. Okay, after the year, so and it's only right because the attachment that a baby has for the mother and everything, that's the like the early years, that's the most important part. It is. Is that. And so they can't provide Medicaid, which would access a whole lot of services that pregnant women need. So just leave us alone. Yes.
Alternative to incarceration. There's always alternatives. Build more houses.
So I think, unfortunately, we are out of time for this part, but I know we are going to have a hot breakout group around this because I think it's an important topic. Can you all join me in thanking our panelists for their words?